You can see why people start smoking, can see why people continue smoking, can even understand why some people with mental health problems may see smoking as supportive. But we can also see how quitting is a good thing to do. The benefits much more outweigh. So we can see why people start smoking, can see why people continue smoking, and I can understand why people with mental health problems can see smoking as supportive. But we've also heard how quitting can benefit you, and you're financially, physically, much better off by not smoking. So I can see why people start smoking, and we can see even why people continue smoking, and I understand why people with mental health problems see smoking as supportive. But we've also heard about how quitting is good for you, and how people will benefit by giving up smoking. It's not going to be easy, but there is support available for you out there. There was a time when you didn't smoke, and then there was a time when you became a smoker. Maybe tomorrow's the time to become a non-smoker again. So we can see why people start smoking, and we can see why people continue to smoke, and I understand why people with mental health problems may see smoking as a support thing. But we've also heard about why quitting is good for you and better for you, and that must outweigh any benefits that smoking gives you. There was a time in your life when you didn't smoke, and then you became a smoker. Maybe tomorrow is the time to take back control and become a non-smoker again.
That's perfect, John.
You know, that's all right.
Excellent.
You think that'll do?
Particularly, we see high rates of smoking among people living with a mental health problem. In fact, the rates are about double that which we see among the general population. Why do so many people with a mental health condition smoke? All sorts of reasons, all sorts of ideas on that. I mean, firstly, there's this idea of self-medication, this idea that people are trying to combat the effects of having a mental illness, whether that be anxiety or depression or just stress and tension, trying to use cigarettes to mitigate against that. Also, we've got this idea of quite simply boredom. Living with a mental health problem, you can find yourself out of work, maybe socially isolated. Smoking can just simply become something to do to fill your time. But also there's a cultural aspect. This idea that smoking has a unique place within the culture of mental health care, that it somehow is even facilitated or encouraged in mental health settings. Certainly, quitting smoking often isn't seen as a priority for people with a mental health condition. So put all those factors together, then yeah, it's no wonder we see such high rates of smoking among people who are also living with a mental health condition.
So, you know, if there are all these reasons that people smoke, and especially mental health services, why quit? What's the sort of benefits to quitting?
There are a whole host of benefits to quitting smoking. I mean, for a start, it's the single most important thing you can do for your health. Not just in terms of cancer, heart disease, but also people say they feel fitter, more energetic, just feeling good about yourself and within yourself, even a few weeks after quitting smoking. Of course, there's the financial benefits, there's the benefits to how you look. Even a few weeks after quitting, your appearance will improve. But really, I think for me, the best reason to quit smoking is about grabbing back some control over your life. Maybe not spending money funding the tobacco companies and the tax man. Take back control, quit smoking. Maybe that's the best reason.
But isn't it different for people with mental health problems? I mean, isn't smoking good for mental health?
It's a bit of a myth, really, that smoking can somehow be beneficial for your mental health. We can see why people think that. You know, you see someone lighting up a cigarette and maybe the first thing they feel is a bit of relief, relaxation. But of course that relief is just relief from the withdrawal symptoms that you experience if you don't smoke for a while. But no, the research is pretty clear on this, is that smoking certainly isn't good for mental health. In fact, it seems to be associated with the onset and worsening of mental health problems such as anxiety and depression. And when we see people quit smoking, studies also show that issues such as anxiety can improve even within a few weeks of stopping smoking. So while it may seem the case sometimes, smoking really isn't good for mental health.
Okay, so it sounds like there are benefits for both physical and mental health to stop smoking. How do people go about it? How do people quit?
People quit in all sorts of different ways. The one single most important tip I can give people who are thinking about quitting smoking is don't do it on your own. Go and get some help. There are plenty of people out there who are expert in this, both mental health care staff and also people who work in NHS stop smoking services. They can offer you not just advice and support through the process, but also help you with things like pharmacotherapy. That might be nicotine replacement therapies like NRT patches or gum. Also, there are medications like Champix that can be really effective in helping people quit. Obviously, all this needs to be done with the advice and support of firstly your doctor, especially because smoking and quitting can affect your medication levels. If you quit smoking, you can actually require a lower dose of your medication, especially medications like clozapine are affected there. So if you get advice, let your doctor know that you're quitting. It's definitely possible. And this idea that people with mental health problems can't quit, it's nonsense. They can and do every day. Was there anything else? Sorry, wait.
Yeah, we need to pause.
I'll definitely get that in. So if you phrase the question.
How do you want it phrased differently?
No, that's fine, whatever.
Okay, so why is it that people carry on smoking? Why do they smoke? What reasons?
People start smoking and continue smoking for all sorts of different reasons. And yes, if you have a mental health condition, we do find very high rates of smoking among people living with mental health problems. There are all sorts of ideas why that may be the case. For example, many people feel that if you have a mental illness, there's some sort of medication effect, self-medicating with cigarettes, maybe trying to combat the effects of stress, anxiety, low mood. Also, many people feel that smoking is so high within mental health care settings simply because of boredom. If you live with a mental health condition, that can sometimes bring with it social isolation, maybe lack of employment. Smoking can become simply something to do. That can be its value. But also one reason why we often see a lot of smoking within mental health care settings is because smoking has actually become part of the culture of mental health care. There's stories, this idea that mental health staff maybe don't see supporting patients to quit as a priority. Maybe even sometimes smoking has been encouraged, facilitated over time. I think that's changing. I think mental health staff are more positive about people quitting smoking. But yeah, we can see why smoking rates are so high among this group of patients. Is that okay?
Yeah. The only thing
I didn't do the addiction.
No, and you didn't. I don't know what
Started so. We tend to see very high rates of smoking among people with. I'll start again. We tend to see very high rates of smoking among people living with mental health problems. In fact, the prevalence of smoking seems to be double that which we find among the general population. There are many reasons for that. One idea is all about self-medication. This idea that people maybe try to use cigarettes to combat the effects of mental health problems, maybe trying to medicate against anxiety or low mood. It's often not that effective, especially in the long term, but you can see why people might try to do that. Another reason why we see smoking in mental health settings is simply because of boredom. Often if you live with a mental illness, that mental illness will bring with it maybe a lack of employment, maybe social isolation. Smoking can simply be a way to fill your day. It can be something to do. It can be as simple as that. Also, of course, one other reason why we may see high smoking rates in mental health settings is because it's part of the culture. It's part of the culture of mental health care. For example, staff maybe haven't always seen helping people quit smoking as a priority. If you have a mental health condition, maybe it's assumed that, well, why is quitting smoking important? But of course it is. And why do people carry on for years smoking? Well, often simply because it's hard to stop. Smoking can be very addictive. It can be really difficult to make that change and stop smoking. It is, of course, possible, but sometimes hard work.